Welcome back to our study of mind rubrics, and let us move forward. And this time, what I've done is I've actually skipped some of the rubrics like complaining, concentration, confidence, want of self, because I felt these were very self explanatory rubrics. But however, if you feel that we should still be doing these other three rubrics which I have skipped, so then please do write your views in the comments section. So let's move on to the next rubric that we are going to study today, and that is confiding. So confiding basically means that when you are in a discussion, when you are in a group and you confide, means you tell something to the people around out of your confidence in them, out of your trust in them. You really trust them. You really are confident that they will not misuse that information, or they will not tell it to someone else. So this is what confiding dictionary meaning is. No, speaking or giving secret. You tell your secret to someone. This is my feeling. This is my truth. This is my thing. This innermost feeling I have shared with you, or about someone else. Someone else, you are talking your inner secrets, your inner feelings, or your personal information in a way that shows you have trust in that person, and you trust that that person will not share it with someone else. He will not, this is a secret, please don't tell anyone. This is how we say, please don't tell anyone. So there is a confidence that you will not tell this to anyone because I shared this with you. But definitely what will happen is you will see these patients telling you that I trust people easily and I tell them my own things, and then I see that they sort of share it with some other people, and then I feel shocked. How could they say this? I trusted him. I didn't think he will do it or she will do it. I thought she's my friend and I can trust her and I can believe in her, or she's my relative or whatever. I can trust that person. But that trust has been broken. That person has not lived up to my trust. And their main feeling is, doctor, in spite of such things happening, I tend to, get flown by the conversation. But next time we meet, when there are four people, people tell me that you should not tell all your secrets to everybody. You should keep it within yourself. But in the flow, I just tend to just tell. And then I feel, Are, did I do the right thing? Did I tell the right person, or this person, is he trustworthy? Mm, is he someone I can tell my secret? So there is a sense of doubt, that should I tell, should I not tell? I have been betrayed, I have been let down in the past, but still I am indulging in such things. When will I learn my lessons? I just keep doing the same mistake again and again. hmm? um, mm, I remember one patient, she used to tell me repeatedly in Marathi. She would tell that, डॉक्टर काही राहत नाही माझ्या पोटात, प्लीज गिव्ह मी समथिंग. huh huh means if anybody tells me a secret, no doctor, I can't keep it in my stomach, it just comes out. I meet people, I just tell, and then, I should not have, yeah, why, please give me medicine so that I don't do this. She used to repeatedly, whenever she used to come for follow-ups, no, she used to tell this every time she used to tell, can't you do something for about this? And frankly, at that time I didn't know this rubric, and now I feel, maybe she needed some remedy from this rubric. So confiding is someone who is constantly sharing their secrets, their personal information without actually knowing whether the person is trustworthy. They keep going on and on. And then when they see that someone has shared their secret with someone else, then they feel very let down, disappointed, shocked. Oh, how could he do that? Hmm? So the remedies also will come up in a similar manner. Hmm? So there are only three remedies that Kent gives in this rubric. The first remedy is hydrocotyle. Now, hydrocotyle, if we read the proving symptoms of hydrocotyle, we see that there are symptoms like loquacity, communicative, talks with confidence. You see, talking with lot of confidence. Are no, I trust everybody, no problem. Let me just share, and then you just go on talking, 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 and then in the second half, there are I think only six symptoms. First three are these, and then there is symptoms like indifference, misanthropy. Hmm? No desire to talk with anybody, desire for solitude. These people, they shared my secret, I trusted them, I was very confident about them. Now they have let me down. So now misanthropy means hatred for people. Now I don't want to talk to people, I just feel let down, I just feel betrayed by them. They have let me down, I don't want to talk to them. So I just don't want to. And I hate, if I, misanthropy means hatred to such people. I hate talking to people. Okay. And hydrocotyle belongs to umbelliferae family, and the main sensation in umbelliferae family is sudden unexpected shock. So it was unexpected that this person will go and tell my truth to someone, so I got shocked. This unexpected shock, let down, betrayed, disappointed, and then developing hatred for people. This is what is hydrocotyle. Hmm? Next remedy is muriatic acid. Now, muriatic acid we know is a halogen, and halogen main thing is what? Let down, disappointed, betrayed by the closest people. So the difference here will be in muriatic acid and in hydrocotyle, both will feel let down, disappointed, in some way shocked that I didn't expect this from this person, etc. But in muriatic acid, it will be by a very, very close person. Like Jan Cholton says, it is Mur stands for mother. Like my own mother did this to me. So it's complete loss of hope. If people so close, it was not a distant person that I trusted, it was a very, very close person that I trusted, very trustworthy person I trusted. Now, this person betrayed me, so then what is left in life? So that's why muriatic acid is feels completely disappointed, and there is no interest in life, disappointed, and they feel they are a complete failure, the sense of failure that they have never succeeded in their life. I am a complete failure, nothing good happens, everything bad happens. Now if your closest people you can't trust, then what is there? Nothing you can trust, nothing is there in this sense of giving up of the world, and nothing is there. I don't want to trust anyone. Lot of sadness, depression, and grief, pain inside that. I've been betrayed by such a close person, and that has really drained me out, made me weak and prostrated, and then we know the physical exhaustion of muriatic acid, where they sit and they fall down on the chair, and where they have involuntary urine while passing stools, or stool while passing urine. They have to pass both of them together. Hmm? So generally, one patient I remember of muriatic acid is this fever that he had, and during this fever he developed diarrhea. So he said, I went to the washroom, and there in the washroom I sat down, I felt I will pass motions, but then I saw that, without my control, even the urine started coming out. That is okay, but both of them came out, and as my stool and urine ended, I just collapsed there, and I just fell down, and I guess down on the floor like that with so much weakness I developed after passing urine and stool. This is very classical of muriatic acid, huh? Prostration, so weak, they can't even sit. Even while sitting, they will just completely lose their whole energy and they will fall down. Hmm? That is muriatic acid. Next is spigelia. Okay. Now, spigelia is also belonging to Loganiaceae family. So, in Loganiaceae family, you see again there is sudden unexpected shock that someone, but in Loganiaceae it is um, death of someone or a shocking news or a bad news that somebody died, so this happened, something bad happened, huh? In hydrocotyle or umbelliferae family, it is sudden unexpected attack that shocks them, that I was sitting here and someone came and then just slapped me, huh? Arey, why you slapped me? How come you could slap? So there is an unexpected shock. I'm sitting here, someone comes from behind, they just hit me on the head. Why they hit, I don't know. So there is a element of injury in Umbelliferae family. In Loganaceae family, there is an element of bad news that something bad I heard, that someone died, something bad has happened, someone met an accident, unexpected accident or unexpected bad news. That is what they are affected by Loganaceae family. And in Spigelia, um, the symptoms are of apprehension, fear that something bad will happen, something bad is going to happen, what is going to happen, and there are a lot of heart symptoms in Spigelia. Hmm. I- However, I have not found very clear reference in Spigelia about confiding and telling the secret and then feeling bad about it. So because it's given in Kent's repertory, which is obviously a very reliable repertory, I am guessing that most probably it is this bad news of hearing that someone has let you down, told you, um, mm, told something, and then you feel very bad. I'm hurt. How could he do that? I'm feeling very bad about it. And along with that, if you have this pin pin like pains, very sharp pin like pains, needles, fear of pointed instruments, fear of pins and needles, very important symptom of spigelia. Hmm? I remember one case of cancer which she had pain in the epigastric region because she had cancer there, and her main thing was I feel like there is a pin and that pin is very sharp, very sharp hot pin there. I feel. Hmm. So this hot needle-like pain is very characteristic of spigelia. Hmm. So that is all I know, friends, about this rubric and its remedies. I hope it helps all of you in your practice, and I look forward to your comments and your suggestions. Before that, I think one of the cross reference of this rubric is secretive, but I think it's also against explanatory. Secretive is keeping secret. They don't share the secret. They, even if something has to be said, they will not say, they will keep it inside. That is what is secretive. So I remember one patient, he was so secretive that he said, I don't tell anybody anything. I said, what do you mean by that? So he says that I have not even told my wife that I have purchased a plot for us in future for savings purposes, etc., or have invested so much of money over here. Or he did not tell his wife that his main chief complaint was hemorrhoids and fissures and very painful fissures, and he was having this since the last 6 months, 8 months, and he says that I am having such severe intolerable pains, but nobody knows, not even my closest friend, not even my father, not even my wife, nobody knows. This is what is secretive. I just keep it within. I don't i don't narrate my complaints, my sufferings to other people. I keep it within. Okay, so that is what I have to share with all of you today, friends. Mm, I hope to see you all in our next rubric. Till then, bye bye.